Hello everybody, I'm Dr. Senthil Kamalasekaran, Senior Consultant at Chennai Ortho Clinic, and today I'm going to talk about osteoporosis and osteoporotic fractures. Osteoporosis is a silent disease. It is diagnosed only when a person falls and breaks their bones. So it becomes utmost important for us to diagnose it before a person sustains a fracture, as prevention is better than cure. There are two types of osteoporosis. One which comes at the elderly age group, which we call senile osteoporosis, and we have the other category which comes after menopause, which we call postmenopausal osteoporosis. The fractures which can affect a person who has osteoporosis are mainly in three main areas: the hip, the spine, and the wrist. I would just take an X-ray to see, but the X-ray is a very poor indicator of osteoporosis. The other things we do is we take blood tests, we check the calcium, we check the vitamin D3 levels, we also check for other parameters like the parathyroid hormone, and we check for the urinary calcium. Gold standard for investigation for osteoporosis is the DEXA scan. By doing a DEXA scan, which is harmless and does not have any radiation exposure, we can actually quantify the osteoporosis to a fairly significant level. The DEXA scan actually helps us quantitate the bone mineral density of a person. If the person has extreme low mineral density, then they are called osteoporotic. However, if they have a fairly medium or a moderate level of bone density, then they are named as osteopenic. And the rest of the people who have a very good bone mineral content are normal people. The treatment for each of these categories is different. If a person is having this condition called osteoporosis, then how do we go about the management? The treatment of this condition can actually fall into three categories. The first one is lifestyle modification. Second is medical management, and the third is surgical management. The lifestyle part actually is very dependent on the person. One, you have to eat a very healthy diet, rich in calcium. The second thing is you should avoid sedentary habits. You should do a lot of exercise like walking, jogging, running, and keep yourself very fit. That helps your bones quite well. And also you should avoid taking certain food items. Excess salt is not good because it depletes the calcium from your body. You should avoid alcohol in excess, and you should also avoid excess of caffeine, by which I mean drinking not more than 2 to 3 cups of coffee a day. Too much of drinking water also is not very good for you. The medical treatment for osteoporosis is diverse. We can give patients a group of medications called bisphosphonates, which includes medications which they can take either weekly, monthly, or yearly. The other group of medications which we use for the treatment of osteoporosis is to help build the bone up, and that group is called teriparatide, and this is a recombinant hormone. The next one helps prevent the bone resorption and hence prevents the weakness of the bone, and that group of medication is called denosumab. This medical mode of management can help treat your osteoporosis and keep your bones healthy and strong. However, if a person sustains a fragility fracture, either of the hip, spine, or the wrist, or any other part of the body, the first primary aim of treatment would be to fix the fracture. If in the spine you have sustained a fracture, which we call a wedge compression fracture, which is not amenable to any kind of braces, painkillers, or bisphosphonate or any other therapy, then we have a procedure called vertebroplasty, in which we increase the height of the vertebra with a small amount of cement in the bone, which will give you immediate pain relief from any kind of osteoporotic fracture in the spine. I hope this short talk on osteoporosis gave you some kind of insight into what the silent disease condition is. If you like this video, please do like, share and subscribe. Many thanks.